It's pretty cool that I get to interview another Dr. Eric. As with me, I have Dr. Eric Kempter, who is an accredited member of the IAOMT, along with serving as the chair of their student scholarship program, which allows students to attend IAOMT meetings at no charge. He is also certified in CEREC restorative treatments, ozone therapy, and member of both the Academy of Laser Dentistry and the American Laser Study Club. Dr. Kempter provides several specialty services at Kempter Holistic Dentistry. He is one of only a few infant lip and tongue tie release providers, along with treating all ages for lip and tongue tie releases. He is also a certified Invisalign provider, ozone treatment provider, and certified platelet-rich fibrin provider. And also, I need to mention, he's my dentist, and it's a pleasure chatting with, again, another Dr. Eric. And thanks so much for being here, Dr. Kempter.
You're very welcome. I'm happy to be here, and I think it's interesting. I get to talk to another Dr. Eric. It doesn't happen very often for me either. So this is a fun thing for me to do here. So I'm happy to be here. Glad I could come on and talk a little bit about what I do.
Yeah. So why don't we start by how you started doing biological dentistry? If you could give a little bit of your backstory, I'm sure the listeners will be interested.
Absolutely. So it's not just me in our practice. We also have my older brother, Dr. John Kempter. So he got me, I'll give him credit. He did get me interested in dentistry at first. And so I can thank him for pushing me down the dental path. But as to biologic dentistry, I don't think most people go into dental school and say, I want to be a holistic or biologic dentist. I think it's something you kind of come to the conclusion after doing your research and critically thinking about some things you're being taught in dental school. And how we got into this, and it was actually kind of a journey with my brother and I at the same time. My grandfather actually had a pretty bad case of Alzheimer's, and he and I both have degrees in chemistry and backgrounds in microbiology and things. And he had a mentor that he worked with that started mentioning safe mercury removal in this organization called the IAOMT. And for your listeners out there, that's the International Academy of Oral Medicine and Toxicology. And it's a fancy long acronym for the Biologic Dental Association or Holistic Dental Association. And we got talking, when I was in dental school, and he started doing some research into the IOMT. We both attended a meeting together, and it's kind of history from there. They taught us, they opened our eyes to a lot of things about the dangers of, using amalgam or mercury fillings, and the dangers to us as practitioners, because if we had a grandfather that had, Alzheimer's and he had a mouthful of these mercury fillings, now we're in a profession where seemingly nobody cares to just drill these things, put them in people's mouths. We worried about our long-term occupational exposure. I certainly didn't want to end up down that path. So we started there. And then, of course, in biologic dentistry, you start with mercury removal, and then you end up down a bunch of other rabbit holes, which, as you listed in my introduction, you end up getting trained in all these different things. And you sort of start putting the big picture together, how your mouth, really ties into your overall systemic health, and how it's not just drilling and filling cavities. It's looking at everything from a 30,000 foot view and how all the puzzle pieces fit together. So that's how we ended up down this. My brother had opened the practice while I was in dental school, just as a pretty traditional family dental practice. And once I got out, we took the deep dive and, wanted to be honest with people that we're a holistic practice. And so we changed our name to Kempter Holistic Dentistry, and the rest is kind of history from there.
All right. Well, thanks for sharing. And so the name, Kempter Holistic Dentistry. Now, I want you to talk a little bit about the difference between biological dentistry, conventional dentistry, and even if you might want to expand on that, the difference maybe between, I don't know, like when talking about holistic dentistry, like before, I mean, this was years ago, before seeing you, I actually saw a holistic dentist who really wasn't a holistic dentist. I mean, they did some holistic things, but they weren't really a biological dentist. So I guess if you could talk about the differences between conventional dentists and what someone would look for if they're truly looking for a biological dentist, someone who, we'll get into like the root canals and the fluoride and all that, but.
Yeah, I think it's, in terms of biologic and holistic dentists, that's a pretty much a apples and oranges. They're both fruits, and they're both relatively the same thing. The difference, I think, what makes us holistic versus a conventional dentist, especially, is knowing what we're putting in your mouth, looking at things from a 30,000-foot view, working with people like yourself, for working with some sort of systemic doctor to make sure that the mouth oral health is not negatively contributing to your overall body's health. And on top of that, like more things like using laser, using ozone. I think there's dentists out there that advertises holistic, but they just kind of dabble a bit. And I'm not sure if it's just because they don't want to, either they don't believe in just about everything we believe in holistic dentistry, or they're worried about, having some sort of consequence for it. We're not. We want to provide what's the best for our patients. So for holistic stuff, using things like PRF, making sure we're not using toxic things, not settling for using root canals, being honest with our patients and saying that stuff's not healthy for you. And I know we're going to get into fluoride and the root canals, and I'll kind of explain why. But I think the best way I can put it is there are some dentists out there that just dabble. You really, really want to look as if you're listening out there and you want a holistic or a biologic dentist that's actually certified, make sure that they're an accredited member of the IOMT. On their website, they have a search directory. The accredited members will be highlighted. That indicates somebody who has done extra training. They have been vetted for sure by the IOMT. They make you send pictures of your procedure, the safe removal process. They're making sure you're doing it the right way. Whereas anybody can sign up for the IOMT, but you want an accredited member because they have been properly vetted at that point. As for what other things to look for, is that dentist offering root canals? That's a big one. We don't do them here in our office, and it's just it's not that we don't say patients can go get one. People can make whatever decision they want to. We just openly don't recommend them because there's more biologic and more healthy options to it. So if you go see somebody and they say, yeah, I think you should go get a root canal, it's a pretty big red flag in my book, in terms of just about how holistic they are. Knowledge of the materials you're using. We do compatibility testing with our patients if we're concerned about reactivity. We know about what materials we're using. You can ask us questions about it, and we actually have a knowledge of what it does and whether it's biologically compatible or not. So, I guess the other thing we do, I said that probably differently than a traditional dentist, is we don't really believe in metal in the mouth. Now, we'll talk about titanium implants, and there is an exception to the rule, but it's in certain instances with certain people. But for the most part, we don't believe you were not born with metal in your body. You should not have metal put into your mouth, the gateway of your body, because it's not naturally supposed to be there. And there is going to be an immune reaction to it, albeit it might be small. It is something that creates an electric charge in your mouth, and it's not something that should be there naturally. So we don't believe it should be there. That's pretty much, I guess, the basic thing I can say. If it's not natural or biologically compatible, we're not going to use it.
Yeah, and speak of the root canals, that was my experience when I went to a so-called holistic dentist. I had a tooth that was too far gone, and he was trying to convince me to get a root canal, and I knew that biological dentists didn't recommend root canals. And I found you on IAOMT, which of course I'm glad I did. But and as you said, they can go through just I guess like it's a weekend, like a conference, and then still be listed on the IAOMT website. But as you mentioned, they need to be certified, because there's a big difference between just attending the conferences and going through the certification.
Right. And like the IOMT, I love them as an organization, but they'll put your directory information up there if you've been to a conference. And you just kind of, as a patient, and I think this goes for just about any medicine or doctor you see, you have to do your research. You have to look at somebody's website. You have to read and get a vibe for what exactly are they all about? What's their knowledge level? So you can read on the website however many meetings they've attended and whether or not they're accredited or not. So there's people on there that aren't even safe Mercury amalgam removal techniques certified. So if you've attended a conference, they'll be on that directory. And it's something I hope they'll change in the future at some point. I'll have to push them towards that at some point.
Yeah, agreed. So can you dig a little bit deeper into the root canals, why biological dentists don't recommend root canals, why you don't recommend root canals in your practice?
So the thing I'll ask people when they come in, and I guess that somebody's asking me their opinion on a root canal, an existing one, or whether they should get one or not. I think the dental community does a bad in a lot of areas, but especially on root canals, explaining what exactly they are, what the purpose of a root canal is. So if I were to ask you, Dr. Eric, what would you say the purpose of a root canal is? Even just when you go to a conventional dentist, if they said, hey, why do I need this root canal? What would they typically say? It's okay to say no, but that you don't know. But
Well, as far as why they would recommend a root canal, I mean, really to save the tooth and to, it's a less extensive procedure than having, having an implant is some of the
right,
rationale that they would give behind it, that you could clean out the canals, which we know is not true.
right. And I don't think that they even get into the canals. I think for your basic, dental consumer or your patient, is they're going to tell you, hey, most of the time it's you just need this root canal, or hey, this tooth still really hurts and the pain's not going away, so you need a root canal. But they don't ever explain what the purpose of it is. Now you've done research, so you know what given your situation previously, you kind of know what a root canal is trying to attempt. And so the basic thing I can explain, what they're trying to do is they're really trying to disinfect the inside of the tooth. So in a situation that you need a root canal, either the nerve has died and there's pain, or a cavity has gotten too deep and there's been a bacterial infection into the pulp of your tooth, which is not just your nerve, it's your blood supply, it's your artery and vein that goes into the life of your tooth, basically. And your pulp is not just the main root canal that they treat. There's the inside of a tooth is that main branch, but it's like a tree, and it's almost like a mini circulatory system inside of a tooth. There's all these accessory canals that come off of that main canal that range in size from pretty big to microscopic, and a bacteria is pretty small, so it can live in just about any part of that, and it reproduces asexually, so it doesn't need a partner. It can just grow and grow and grow inside the tooth. So a root canal, they're gonna try and shape the main canal so that they can get their liquid bleach, and that's exactly what they put down in there during a procedure. They don't call it, and they actually teach you this in dental school, to call it sodium hypochlorite. Now, those of us with the chemistry degree know that that's bleach. That's conventional household bleach, and they'll have a special version that's dental rated, but they're trying to put that liquid bleach down into that tooth to try to disinfect that tooth. Now, that liquid cannot physically penetrate all of those accessory canals. And an interesting statistic that they figured out with cone beam technology, is there's almost up to 3 miles of canal structure inside one tooth. If you stretched it all out, you can, in a single upper molar, you can find up to 3 miles worth of canal, which is it's insane to me that you can find
Yeah.
that much in a single tooth. So I don't think that liquid bleach is traveling 3 miles. So while it's disinfecting that first part of the canal, it's not going to get everywhere. So if you leave a single bacteria inside that tooth, it's going to reproduce at some point, especially the type of bacteria that's down inside of a tooth. It's anaerobic. It does not need oxygen to survive. And it likes an environment that doesn't have any light in it. So a root canal inside of a tooth, you go and you seal it off, and you've sealed this bacteria off inside this tooth with no oxygen, no light. You've given it the exact environment it needs. So essentially, you've left a dead infected tooth in your mouth. And yeah, it doesn't hurt because you don't have a nerve in there. So from a biologic standpoint, as a holistic dentist, my problem with it is that it's a locus of infection that's there. Your immune system has to contend with it. And especially given your expertise with the thyroid, it can exacerbate autoimmune issues, which if you have underlying thyroid problems, it's not a great thing to have. But there's certain associations with teeth called meridians that we believe that if you put a root canal there, you're blocking a meridian. You're going to have some dysfunction, some association with some other area of the body. The most common one that I hear, and the most common one that we've observed in terms of a correlation, is upper molar root canals and breast cancer. A study was done in Germany where a researchers found that out of their cancer patients, I think it was the select pool. So again, the number might not be exactly this, but in this select pool of breast cancer patients, they found 97% of them had a upper molar root canal on the same side as their breast cancer. So knowing that there's that correlation, and I'm not saying cause and effect, I'm saying correlation. So there's just an observation they noticed. that's enough for me to say I wouldn't recommend a root canal pretty much anywhere in anybody's mouth, just for that very reason, because who knows what systemically it's going to do. And the other problem I have with it is you hear about people needing root canals retreated. Or, hey, my root canal got reinfected. I had this root canal done X number of years ago, and now I come back and it's got a huge infection in it. And they'll say, oh, it got reinfected. Well, yeah, it got reinfected with the same bacteria that was already inside the tooth. It just happened to find its way outside of the tooth. And now you're going to go ahead and pull this thing anyway. There's rare you're going to have it retreated a third time. I know I wouldn't go back into the well a third time if something failed twice. So we feel in our practice, especially, and again, this is our professional opinion. It's just based off some of the research we've seen and some of the clinical observations we've seen in our office. If you have a tooth that's failing and there's pain and there's bacterial infiltration in it, it is a much healthier and safer option to have that tooth removed. As daunting as that sounds, it's healthier for you to have that infected tooth taken out of your mouth, that dead tooth not there in your mouth, and replaced. It's 2022. We have great replacement options for teeth. Implants work great. Is it a longer procedure, and does it take a little bit more work to do it? Yeah, but this is our health we're talking about here. I think that in the grand scheme of things, the whole implant process can take as short as 4 months, and usually our average is about 6 months start to finish. That's a relatively short period of time in somebody's life, to have a healthy situation, rather than having a root canal in your mouth for 15 years, dumping endotoxins into your system and causing potential other problems. So that's really our main issue with these root canals. It's just that they can cause more problems, and it's not worth it for us just to hold on to a tooth that we have a better replacement option that's healthier for you.
And I think it was another podcast where a holistic dentist, biological dentist, was talking about possibly lyme being like harbored in the root canals. Have you heard about that when it comes to infections?
I've heard that there's similar bacteria. The one thing I have heard, and the thing that they've actually observed, and this is traditional researchers doing this is traditional allopathic medicine. If you scrape the plaque inside of a clogged artery on somebody that's had a heart attack, the bacteria that populates that plaque buildup in the coronary artery, is the same bacteria that the only other place it's found in the body is in endodontic infections in teeth.
Wow.
So the American Academy of Cardiac Prevention, if you look up on their website, they will tell you 96% of all heart attack associated problems stem from bacteria in the mouth. And root canals are a huge source of that.
So taking out, as far as removing, not physically removing root canals, but assuming someone doesn't have root canals, then that also, I guess, leads into the importance of just regular dental hygiene, seeing a dentist a few times a year, flossing. Because some people blow off the impact of gingivitis or periodontitis, but that really, so that could be a big deal as well, as far as cardiovascular health. It sounds like it.
Yeah, if you have periodontal disease in any fashion, and bear in mind, gingivitis is a form of periodontal disease. Even just now, not saying like localized, everybody gets a little bit of bleeding here and there, but if you have general gingivitis around your mouth, if you get constant bleeding there, bacteria, that same bacteria is going to affect cardiovascular health. People with periodontal disease, there's a much higher correlation for people with periodontal disease with high blood pressure, diabetes, and their chances of having cardiovascular problems. Again, that same bacteria they find in the coronary arteries is not just endodontic infections. There's gum infections. There's periodontal infections that play the same role in that. So yeah, it's again, having a healthy mouth overall. If your front door is dirty in your house, you got mud and all kinds of an unsafe situation there, you're dragging all these things into your house, and that's the best analogy I have is if your mouth is dirty, you're swallowing bacteria constantly. You're introducing bacteria not only through your bloodstream, but also like through your digestive system, through your gut health. It's going to make it through there. So this is super important. This is one of the only accesses into your body. We only have so many, and your mouth is by far the biggest one, the one that's most used.
What are your thoughts about oil pulling when it comes to like prevent? If you have periodontal disease, probably oil pulling is not going to reverse that. But as far as a preventive measure, along with brushing and brushing and flossing.
It's the best adjunct in terms of mouth rinses. You know, that's for sure. If I could get if everybody had 14 minutes a day to do oil pulling, we'd overall as a country have much better oral hygiene. It's just such an effective natural way to do it. You know, everybody likes the minty flavors of mouth rinse, but if you ask my colleague Dr. Jerry Curatola up in New York, who's a big time oral microbiome specialist, anything that's got alcohol in it, mint in it, or anything like that is going to destroy your microbiome in there. Coconut oil pulling or sesame seed oil pulling or sesame oil pulling is not going to affect good bacteria like that. It's going to pull the bad bacteria out. There's a reaction that happens there. And it's the one thing that I see clinically in my practice, that if I have a patient that has a gingivitis problem and they change their oral hygiene habits and they add oil pulling in there, it's a night and day difference between the first recall to that next recall appointment or cleaning appointment. So it's something that I highly recommend. People have been doing it for thousands of years. I think there are records of it from thousands of years ago where people did oil pulling. The thing I will say, and I wish that some of these oil pulling direction websites would have this on there, if you have mercury fillings in your mouth, do not oil pull. It will pull mercury off of those fillings. You will dose yourself with mercury more so than even just chewing or drinking a hot cup of coffee. It is a really, really bad thing to do. I have patients come in and say, I've been oil pulling for the last 6 months, and I look and there's a mouthful of mercury, and I say, yeah, please go ahead and stop that until we get all of this out. But if you have no mercury fillings in your mouth and you want to add it in as your adjunct, it's by far the best adjunct you can use.
Yeah, that's good to know about the mercury. It makes sense if you have mercury in your mouth, mercury amalgams, not to do oil pulling. So with that being said, if you don't mind shifting to talk about mercury a little bit, and one question I have that's along those lines is there risk with doing other things like taking, I don't know, like chelators, or even taking like alpha lipoic acid, like things that people use to detox mercury, if you have mercury amalgams?
Danger, I'm not sure. And again, it's not my detox is definitely not my specialty. I do obviously work with a lot of people that do it. But what I will tell you is, from a logical standpoint, if you go and you try to do a detox and you still have these things in here that are dosing you with mercury, it's kind of a pointless thing if you think about it. So most of my naturopathic, referral sources and people and colleagues I work with, they almost require their patients to have all their mercury out before they go through any sort of detox protocol. Because again, it doesn't make sense to constantly still be dosing yourself in your mouth with mercury, releasing mercury vapor, and then you go and you take detox, you're just rebuilding up the mercury again. So especially heavy metal detoxes makes no sense. So my recommendation from a dental standpoint, you come from somebody that wants you to get detox done, you need to have your mercury fillings taken out.
What do you say to patients who have had their fillings for like 20, 30 years and they seem fine? They're like, oh, I have like 5, 6 fillings, or again, maybe they only have like 1 or 2 fillings, but they're not convinced of that mercury is causing harm, just because again,
that's ultimately their choice. I'm a big proponent of patient choice. So if somebody says to me, Doc, I've had these mercury fillings for 25 years, I've never had a problem with them, I'd rather keep them in my mouth. Okie dokie, that's your choice. We're not going to polish those fillings when you come for cleanings, because that's going to expose my staff if they're not wearing the proper safety gear. I always explain to them it's healthier to have them out, but by no means do I force those people. And the analogy I try to give them is, look, you might smoke cigarettes for 20 years and not have a problem. That doesn't mean that at year 22, 23, 24, 25, and so on and so forth, that you may not find some lung cancer after that. It's just something I'd rather be safe than sorry. Ultimately, when it comes down to it, if they don't want to remove it, that's their choice. Our best thing I can do is arm them with the information to make that conscious health decision.
Yeah, and that's where I was getting at. Obviously, you can't force them to get their amalgams out, but as far as education, just because they're feeling good and they're fine, doesn't mean that maybe it's causing some underlying problems they're not currently aware of, or it may cause problems down the line, as you mentioned. And of course, most people listening to this have a thyroid or autoimmune thyroid condition. So,
Right.
so again, and that there could be that connection too, which I don't know if you want to talk about, or if you want me to talk about, as far as mercury, how it could affect thyroid or affect the immune system.
It's your podcast. I'm all for it, man. I love hearing about about the thyroid issues. It just reinforces the toxicity of these mercury fillings.
Yeah, the immune response is my concern when, most people with thyroid conditions, as you mentioned, Hashimoto's, the most common autoimmune thyroid condition. And then I also, myself, I have a history of Graves' disease. So the concern is not everybody. I mean, everybody has different triggers. So if someone comes in with Graves or Hashimoto's and they have a bunch of mercury amalgams, obviously I can't say definitively that that's what's responsible. It's just a potential trigger. There's a number of different potential triggers. And like you said, in a perfect world, you'd want to get those removed. Not everybody I work with will get them removed, but there's numerous reasons, cost associated with that, or just fear of going to a dentist, but again, yeah, ideally in the future, you would want to get those removed, if not presently.
Mm-hmm. Yeah, it's the way I try to explain it when I've got somebody with a health issue and they're asking me, well, what's the benefit of taking the mercury fillings out? Or I guess the better example is you've got a crown that's porcelain fused to metal crown. So a lot of crowns that were done back in the 80s and 90s, due to the constraints of labs, they used to do these metal-based crowns that they layered porcelain on to look like teeth. The problem with those is, one, they're made of nickel, and two, we can't see what's underneath them. So if you have an underlying issue, or potential for it, I would rather know than not know what's underneath these things. And so if you're having an issue, while you said taking the mercury out may not be the trigger that fixes their problems, I look at it more like an elimination diet. You want to take any potential cause out, especially people with thyroid or even other odd health issues. A lot of my patients are coming to me because traditional Western medicine has failed to help them with their problem, and they're going down the natural way of, all right, let's start taking let's approach different things. And dentistry is just one of those things where I get questioned a lot about, doc, is taking my mercury going to fix my problem? I don't know. I know that it's not healthy for you, and it very well could be the straw that breaks the camel's back here in your situation. We have seen that, but it's just not healthy to have it. And if I'm in a situation where I've got a thyroid issue, or if I've got a gut issue, I'm going to want to make sure that my playing field is completely clear, and I give my body the best chance to heal itself and fix this issue that I possibly can.
Yeah, and I guess it's similar with root canals too. Like if someone has a chronic health issue, and if they have one or more root canals, you can't guarantee that removing the root canal will, cure or help to restore their health. But maybe it's a factor, like you said, maybe it's a straw that broke the camel's back, and it's at least a piece of the puzzle. Correct?
Right. It could be part of the equation. I mean, you could have root canals causing this bacterial buildup, and it could be one of the things that's making an autoimmune issue worse. It could be one of the things that's plus another couple issues that's causing your problem. It's any number of things. And again, I've seen where we happen to catch people at the end, and this happens to be the last thing that they need done that's going to solve their issue. And we see really, really crazy health turnarounds with people. And I have others that are sick, that come and they do all this stuff, and they need other work done. They need other detox done. And sometimes I get some discouraged patients, but I try to explain, again, like the elimination diet, this is just one piece of the puzzle. You need to see a naturopath. You need to go check out different things, get chiropractic care, make sure that we're on top of all of that stuff. Optimize your body for healing. And you may find that they go to another practitioner, get ozone IV therapy, something like that detoxes them out. Next thing you know, they're doing great. It just all depends. But for our side of things, we know that these things are not good for you. I know root canals are not good for you. It'll annoy traditional dentists, the ADA, the American Academy of Endodontics, probably my dental board. But I say it in the sense that there are better options out there. Nobody can prove to me that a root canal is going to last longer than an implant, because statistically speaking, nothing beats an implant in terms of longevity, safety. The integration into the body is much, much better. So while the dental board will take the company line here, those root canals fail pretty often. And again, I believe, my professional opinion, that they're not healthy for you. So we just think there's a better way. And for those out there that are dealing with the thyroid issues, if you just keep taking away pieces of the puzzle, you'll find a lot of times that's where you find your success.
Yeah, you mentioned making the ADA mad, so I don't know if you want to touch upon fluoride, because I'm sure they frown upon dentists not talking. So do you mind talking a little bit about fluoride? Why, again, biological dentists don't recommend fluoride?
Dr. Eric, I'm pretty secure in terms of what I believe in dentistry, and my brother and I have taken the stance that I'm not going to be afraid to speak my mind. We never have been, even since I was a kid. I'm not afraid to speak my mind about what I believe. It's because it's what I truly believe. Fluoride itself, look, I think fluoride is one of those things that the ADA has really just kind of has glommed onto as something that is just absolutely one of the forefront of dentistry. This is standard of care stuff. Fluoride, I'll start off with this. Fluoride works in remineralizing your teeth in some fashion. I will say that. It can desensitize your teeth. It has to be on there for a really long time. I don't think people realize that. Like the most effective fluoride is fluoride varnish. They paint it on your teeth at the end of your cleaning. They do it for kids a lot, and it's sticky, and it sticks there for 24 to 48 hours. That's when it's effective. Fluoride is, and I guess, again, going into the history of it, used to be, they used it as rat poison in the early 1900s. If you type into your web browser fluoride rat poison, you will see advertisements from like the 1910s and 1920s. They used to sprinkle it around to kill rats. It's not safe. It's one of the most it's the most electronegative chemical on the periodic table. It's the most reactive species on planet Earth in terms of elements. And in your body, it reacts in a lot of interesting ways that are not very good. Fluoride is an endocrine disruptor. It settles in your bones. It's essentially, in the basic of terms, can make your bones weaker. Now, the thing that I try to explain to people and my traditional dentist friends, why I have a problem with it, is if you look at kids' toothpaste doesn't have fluoride in it. And I don't think anybody's ever asked and said why. And the dirty secret is that kids are not very good at spitting toothpaste out. And if kids swallow it, if you look on the back of your fluoride-containing toothpaste, they tell you to call poison control if a kid eats toothpaste. And it's because of the dose of fluoride that's in there. And so as adults, the conventional thinking is, well, an adult's going to spit their toothpaste out. How many people use mint toothpaste and just swallow it because it makes their breath smell good? So while, albeit it's not a huge dose of it, over time, constantly swallowing fluoride is not great for you. I think there was a study that was done too with kids. My big problem with them is with them taking fluoride or using fluoride in a pediatric sense is the fluoride has the tendency to calcify the pineal gland. Now, for those of you out there who are not, anatomy specialists, the pineal gland is what they call the essence of life. That's what the gland that controls timing in your life. So when it calcifies, it's indicating to your brain that you're getting older. And for especially young ladies and young pre-adolescents, it's a good timer for when you're supposed to hit puberty. And so an interesting study that was found, or a situation they did, was they went to, I believe this was in China, and they went to rural communities. There's a lot of these outreach programs. Got to fluoridate the community in these rural well water, areas around the world. And in this particular village, they over fluoridated the water. Their conventional thinking was, well, we probably should give them more fluoride because their oral health's really bad. So let's up the dose of fluoride that's in the water. And they started noticing that the girls that young as 7, 8, and 9 years old were hitting puberty, and it's not normal, and it turned out that they had to knock back the levels of the fluoride in the local drinking water because there was too much in there. So what it was doing, it was calcifying the pineal gland. Their bodies were saying, hey, it's time for us to get to child rearing age. Let's go ahead and move along with this. And so here we are. The other thing too is I think this probably applies to a lot of people in my age group. I'm 37, but we used to have the programs, and Dr. Eric, I don't know if you had this in school, where they used to have the swish and spit program at your school nurse, and you'd go in, you'd swish the fluoride, and you'd spit it out. And I think this was dental programs they did in the 90s. But a lot of people my age, I notice, have the white spots on their teeth. And I'm sure some of your listeners have it. You probably ask yourself, where did these really white spots come from on my teeth? That's actually a form of dental fluorosis. So actually, too much fluoride can damage your teeth. So again, you're trying to find this happy medium in a general public that does things like swallowing toothpaste because it tastes good and it makes your breath smell good, even though it's not healthy for you. So our problem, again, it's a toxic material. The long and short of this is you don't need fluoride on your teeth if you have the proper hygiene regimen at home. The biggest driver of cavities and problems in your mouth is plaque and bacteria. So while fluoride will remineralize your teeth and prevent cavities, which I don't actually believe that it does, because I think some of the studies are really flawed. I actually think there's a study out there that shows there's an even rates of cavities in fluoridated versus non-fluoridated communities. So again, I think it's a moot point. I could go again deeper into how fluoride got in our drinking water, but that's a whole other thing. But the rates of cavities are the same. So for us, why would you expose yourself to something that's we used this rat poison back in the day, when you all you have to do is just mechanically clean your teeth every day. Use coconut oil pulling, which is much healthier, and you could even find a nice mineralizing toothpaste. My friend Dr. Jerry Curatola has a wonderful one in Revitin online, and we also offer Risewell toothpaste here. And again, we're not sponsored by them, but it's just a great mineralizing toothpaste. They are out there, so there's better ways to do it. Is the whole long and short of this fluoride thing, without having to expose ourselves to a pretty toxic chemical.
Yeah, thanks for sharing. And the reason why I wasn't sure if you would share is because one of my past podcast interviews was a medical doctor, wasn't a dentist, but she was talking about environmental toxins. And when I brought up fluoride, she was like, yeah, fluoride's bad, but I can't talk about it. She didn't want anything to do with it. So I got the impression she was it seemed like she was concerned about getting in trouble. So I didn't know.
I don't know. If you know some of the members of the IOMT that I'm with, we have the research, we have the science behind us that shows that it's not really great for you. There's a documentary, and I think it's available on YouTube. It's called Fluoride Poison on Tap. It'll give you a good idea on where our modern day fluoride comes from in our drinking water. And I think people would be probably pretty appalled when they see where it actually comes from, and what it can do, and some of the effects it's had on people. It may not get into it more of like from a dental, what does it do to your teeth kind of thing, but it does show how we got to the point of putting it's a prescription drug. Fluoride's a prescribed drug, and it's the only one that our government forces you by putting it in your drinking water to take. So,
yeah.
I encourage your listeners to check that out. And if you don't have a filter at home, a Berkey water filter, which is what I recommend for most people, it's a pretty reasonably priced, water filter. Getting a reverse osmosis filter in your whole house, hopefully with some sort of remineralization in there, so you don't, you're not drinking pure water where you're getting cramps and things. You do need some minerals in your water. That's the best thing I can suggest to get the fluoride out of your water and to be drinking the safest tap water and showering in the safest tap water. And
obviously no fluoride toothpaste.
No, there are some really good, all of your brands of toothpaste should have non-fluoride toothpaste. And be careful about, even if it's a natural, quote unquote, natural toothpaste, you need to check out who owns that company, because the big boys like Procter & Gamble, Colgate, those guys have started buying up a lot of these smaller toothpaste companies that are quote unquote fluoride free and changing the formula on them. So, just keep a lookout for what you're using. And if the base The base thing for toothpaste is just making sure that it's slightly abrasive. It's going to polish your teeth. Any other little things in there is just bonus.
All right, cavitations. Can you talk about what cavitations are and why they are concerned?
Yes. So a cavitation is a locus of infection in your bone. So the basic way I can describe this is when you get an extraction done, you have a tooth removed. The things that are left over are the socket where the tooth was, so where your roots used to be, and then the ligament of the tooth. So the teeth are held into your head. They're not just fused into your bone. They're held in like any other bone-to-bone connection through a ligament. In the mouth, they're called the periodontal ligament. And after the extraction's done, if your dentist or oral surgeon doesn't take the time to clean that site out, completely clean it out, scraping the entire ligament out, treating the area with ozone, if you leave any of that material in there, the body's going to heal the bone over, and that ligament tissue is going to turn into a necrotic bacterial infection, essentially. So while you may not notice any pain directly with it, you may have some health problems that are associated with it. Again, and some of the thinking of it amongst my holistic practitioners is that area of that locus of infection is located along a meridian, and it's causing a problem with another organ system. So the general gist of this is you need to find, if you're going to have an extraction done, somebody who's definitely going to clean it out the right way, and there's somebody who uses ozone gas, which kills bacteria, sterilizes sites, and ensures that ligament tissue is, one, not alive, and two, any bacteria that's associated with it is dead. So the other side of that is, now with the advent of using what we call platelet-rich fibrin, and I know you mentioned that in my intro, it's essentially stem cells. So we take your own stem cells and white blood cells that are in that layer that we extract. We mix that with bone graft material, or even just put the membrane in on its own. And that's another way you can ensure that you're not going to have a cavitation form. So we have people that come to us with really kind of odd health problems. And usually we're looking at not only root canals and mercury fillings. The other thing we're looking at is for cavitations. And the notorious place is wisdom tooth extractions. Generally in the lower jaw area, we'll take a look on our cone beam CT. And for those out there who aren't familiar with cone beam, it's essentially an MRI for your mouth, where we can look at your jaw bones and your structures in all different directions to really get a good diagnostics on it. I highly recommend, if you go to a dentist, get a CBCT done, get it analyzed by a radiologist. We do that for every single patient that comes to our office. But the CBCT will show an area of low density bone. It'll look, bone is supposed to show up white on a CBCT or on an MRI. And a cavitation typically will show up very dark looking. A lot of times we'll actually still see the outline of the old tooth root that was in there, because that's the ligament tissue that hasn't been scraped out or cleaned out properly. And so that's where we can see that infection. And I've seen some really obvious looking ones in there. Normally your gum tissue is healed over, so we have to get in there, open the gum tissue up, and almost 10 out of 10 times we get in there and we'll see that the bone is actually brown. And it's soft. You can clean it out. Literally, you can scoop this material out. And so if somebody gets that treated, we clean it out, ozone it, put some PRF in there, stitch it back up. A lot of times they'll notice a big change. Even that's actually where we see the most change with people, is when we do these cavitation surgeries, is they start having a problem and they notice that, wow, that problem got a lot better. My immune system, I feel like I have more energy. Their immune system's not having to constantly try to attack this area of necrotic bone that's here. So it is something that we do recommend you have checked with your dentist or your biologic dentist. Make sure that they're checking for these areas here. And again, notoriously, it's usually wisdom tooth spots.
Yeah, actually, do you recommend, pretty much it seems like most dentists recommend for everybody to get their wisdom teeth pulled. Are you against that, or what are your thoughts on that?
It depends on the situation. From an anthropological standpoint, we have gotten smaller as a species, all right, and that includes our jaws. The wisdom teeth, in ancient times, our jaws used to be a little bit bigger, so we had room for those teeth. some people still have room for those teeth, and some people can keep them clean. If you can keep your wisdom teeth clean, you can keep them. I don't want to unnecessarily take teeth out for no reason. The fact of the matter is that in most cases, people's wisdom teeth are coming in weird. They're partially up. They're partially soft tissue impacted. In other words, there's a soft tissue pocket around the tooth. They get infections on them. It's really hard to keep them clean. It's hard to floss them. And rather than constantly having infections or having the potential for very large decay that's going to cause eventually an abscess in somebody's teeth, we recommend you get them taken out. Now, who should you have them taken out by is the million-dollar question. I have several oral surgeons in my area that I recommend, and it's because we've had that discussion about using ozone, and they're open-minded to it, or using platelet-rich fibrin therapy. And I know for a fact they're really good practitioners, and they're going to take the time to scrape that site out and clean everything how it's supposed to be cleaned the proper way. Oral surgeons like making money, so like anybody who owns a business. And a lot of times, if they're seeing a high volume of patients, they're going to pull that tooth and they're going to quickly scrape it out, not really taking the time to really make sure that it's fully clean. So I guess the best answer I have is it depends. It depends on the individual situation. And that's, again, a discussion for you and your hopefully holistic dentist.
Yeah, no, thanks for sharing that. Yeah, I'm one of the few people, I guess, who have all their wisdom teeth, and
if I remember correctly, you have the room to clean them, and you do quite a good job of that. So that's essentially the rule of thumb.
yeah, well, thank you. Yeah, and of course, you help with the cleanings, the regular cleanings when I go to you as well. And so one question I had also, which you already answered, is like what newer treatments or what newer procedures, technologies, and not necessarily newer, like ozone isn't new, but you don't see conventional dentists
Right,
do
yes and no.
ozone. And you mentioned a cone beam, which you do, and the platelet rich fibrin. So are those like some of the main things that you do that other dentists don't do?
That's probably what you're going to find is the most different in our office. Yeah, ozone's funny because people say, "Oh, it's this, wow, it's this new thing. I've never heard of this." It's been around since the early 1900s in terms of disinfecting surgical suites. They used to use it. It's so old in terms of a technology from a medicine standpoint. It's actually grandfathered in under the FDA. So it's probably so. In other words, there's no regulation on it because the FDA can't do it. Because it's grandfathered in. Platelet-rich fibrin therapy is relatively new. That's the one we use the most. We use that pretty much in every extraction. And that's something that has been around, I'd say, for about 12 years. But in other newer technology, CEREC, you mentioned that. That's a relatively new thing we do. It's about 20 years ago, they came up with this German technology that can make onlays and porcelain crowns in office. So you've essentially taken out the middleman and given the dentist a lot more control in terms of custom fitting your crown. And I know there's plenty of people out there that have had a crown made traditionally where they send it to a lab and you wait 2 weeks with a temporary that's sensitive, it doesn't really fit well. You get back, you come back in 2 weeks to have the final crown put on, and next thing you know, it doesn't fit. So now they got to put the temporary back on, take a new impression. It's a very antiquated way to do crowns. The CEREC system has now taken 3D technology to mill out porcelain crowns in-house. So you get instant feedback and they're much healthier and you get to really pick the materials you're using. The other technology I would say is really new is laser therapy in dentistry. They are now developing really nice lasers that can actually do fillings without anesthesia. So the wavelength is used, the wavelength of light used, of laser light used under the erbium laser is done in such a way that it doesn't irritate the nerve of the tooth, so you don't feel pain. Now, is it perfect? No. It definitely is. It's going to need a little more research and usage and clinical trials and things, but we definitely can do it where we don't get pain during a filling. So for kids, I use the laser a lot on kids because I don't want to get kids numb if I can help it. They're not the most fun people to give anesthesia to, but especially adults that are really anxious about getting dentistry done. So there's a couple lasers out there. If your dentist is using it, they usually advertise it. It's a photonal laser or a water laser or something of that nature. And as for that, technology-wise, or at least conventional, or thinking of philosophy-wise in our practice, we've added a lot of things like making dental sleep a big deal. Your sleep, how is your sleep affecting your dentistry? I don't think a lot of people realize when you snore, that can cause clenching of your teeth, which can damage your teeth. So we've added that in. I wouldn't call it a new technology, but just a new philosophical thing in there. So there's a lot of cool stuff out there. And again, I leave it to my patients to do their research into who they're seeing, you know, especially if you're not in the Charlotte area, you don't want to come see, you can't come see us. Really research the technology. Ask your dentist what the technology is all about. They should know whether or not what it is, what it does, and how it works. And if they can't answer those questions, don't use that tech. Don't have that technology done to you.
And then the last thing I wanted to chat with you about is getting back to the implants. And so you mentioned earlier how you don't recommend titanium, you recommend, ceramic, zirconia. So that's also something that most conventional dentists don't do. They still stick with the titanium. And I imagine if someone comes to you and they already have a titanium implant, you're not going to tell them to like switch to zirconia. It's just if someone needs a new implant, that's where you'll recommend the zirconia implant.
Preference is always to use zirconia, and those zirconia out there is a ceramic implant, and the technology is relatively new. We've placed thousands of these things, and we've had some really good success with them.
Including myself.
Yeah, I was about to say you have one too, so you know this intimately. It is always the preferred implant in our view, because your body's immune system doesn't recognize zirconia. The integration into your bone. Implants aren't in your jaw mechanically. It's not just that you screw it in and it stays in that way. Your body actually fuses it to the bone. And they found that the rates of zirconia, because your immune system doesn't recognize it as a foreign object and there's no electrical charge associated with it like a titanium implant has, your body actually integrates that thing really well if it does it well. Now, the technology is limited in terms of, and I could get into it really deep, but the connections inside of zirconia implants are they're still researching and developing those perfectly. So I think in the next 5 years, that's probably going to be the standard of care, is doing a zirconia implant. But it's the safest, most healthiest implant to put in your mouth, in my opinion. Now, that being said, there are situations like if I'm working with very thin bone or a certain bone type, a titanium implant that is mixed with zirconia. They have ones that are a titanium zirconia alloy. I am 100% okay with those, because sometimes you have to take the balance and weigh the good with the bad. Do I need teeth to eat? Yes. So if I don't have teeth, I need to have implants placed. And if the titanium ones are the ones that are going to connect to a denture the right way, which titanium ones have the best connections to dentures, zirconia just can't handle the type of forces that are on there quite yet. I'm sure they'll get there. Then you have to take the good with the bad there. The titanium zirconia alloy ones we use in our practice because we find that people are not reactive to them, especially more so like the traditional titanium implants that have a titanium nickel alloy. That's my problem with traditional titanium implants, is it's alloy with nickel. Titanium itself, while it's a metal, it's pretty biocompatible. We use them in knee replacements all the time. People tend to do it pretty well, but titanium is not strong enough on its own. It needs to be an alloy of some sort in order to be strong enough to handle the forces in the body. And that goes with chewing and everything like that. So preference is always zirconia implant. And 7 out of 10 times we're placing a zirconia implant. 3 out of 10 times we might need to place a titanium zirconia mix in there. And they're okay. It's not my 100% favorite, but I'm okay with it. And if my mother needed one, I'd be fine putting it in her mouth.
All right. Well, thanks for sharing. Yeah, I didn't realize that titanium implants weren't pure titanium. So you're saying
Nope.
it's titanium and some nickel in there.
Most metals are actually pretty brittle on their own. And titanium, especially elementally wise, it will be malleable and bend and shatter. It's not going to be able to take that tensile strength of chewing. So it has to have some sort of alloy to strengthen it and to make it flexible and to give it some other properties to it. So while somebody might advertise 100% pure titanium, it's just patently false. There has to be some alloy in there.
All right. Well, thank you so much for sharing all this information. Anything else that you want to share? You shared enough, so it's fine. If the answer
um,
is no, because we spoke longer than
no,
intended.
you're
But
good. No, I would just the message I have for people and people listening to this is just always do your research. Um, my brother and I take our holistic dentistry very seriously in terms of how we treat people. If you can't find somebody that does that, if they don't believe, if they're not, if you can't vet them properly and they can't explain what holistic dentistry is or what makes them holistic, or if they offer you root canal or they aren't questioning these things, then you need to find somebody that does. So don't settle for your practitioner. Don't settle just because somebody is lists themselves as holistic. Do your research. I tell my patients all the time, don't just take my word for things. I know a lot about dentistry and I've done my research, but please do your research on your own. Question what I'm asking you. Ask me to show you the proof. You should be asking every doctor that stuff. And if they get mad at you, they're not the right person for you. So just make sure you guys do your research with it. And if you guys ever have any questions or anybody wants to contact us, it's kempterdentistry.com. And our email address is info@kempterdentistry.com as well. So you can reach us there.
yeah, and you have locations in Concord, North Carolina, which I used to go to before you opened the location in Charlotte, North Carolina. And yeah, awesome dentist. Obviously, else I wouldn't continue to
I
go. And I've
appreciate
been
it.
to other dentists over the years, including other biological dentists. So again, very open to questions and just amazing. And I've seen not just I mainly see Dr. Eric, but I've also when getting the implants, I saw your brother. And again, I think I've seen all the dentists I've seen
Yeah.
in your practice at one
we
time or another. So
Yeah, it's
and
we have a good group here, and we pride ourselves on training everybody the same way and having very strict protocols and keeping a high standard of care. So we have just about whatever kind of dentist you need here. If you like Dr. Myers more, Dr. Wilbanks more, we don't get offended. I do work with my older brother. I always say I'm the younger, better looking Dr. Kempter. So I always say come see me, but he's a great dentist too. He's my dentist. So like I said, if anybody needs any information or if you want help finding somebody in your local area, you can always shoot us an email. We'd be happy to help.
all right, awesome. Well, thanks again, Dr. Eric, for sharing your knowledge about biological dentistry. And I look forward to my next teeth cleaning. I think it's going to be a few months from now. But
Sounds
again,
great.
thank you for getting together and for agreeing to do this. I appreciate it.
You're very welcome. It was my pleasure, and I look forward to seeing you in the office soon.
Same here.